Hi, my name is Dr. Diwan S. Raja. Today I will discuss about the alpha blockers. The alpha blockers are alpha adrenergic antagonists. They are alpha adrenergic antagonist. They are the sympatholytic agents. Sympatholytic agents, and they prevent the action of the epinephrine, also partly the action of the norepinephrine. Okay, we have two type of alpha blocker. One is non-selective alpha blockers, like that of the phenoxybenzaimine and phentolamine. These are non-selective. This is irreversible. It has long duration of action, phenoxybenzaimine. This is reversible. And here it is long duration of action, maybe around 24 hours. This is short duration of action. Okay. So these are two drugs, non-selective alpha blocker. They work on both the alpha 1 receptor and alpha 2 receptor. Alpha 1 receptors are present on the peripheral blood vessels, on the smooth muscle around the sphincter urethra, smooth muscle around the prostatic part of the urethra, and also in the smooth muscle around the prostate or inside the prostate. Okay, so they work on that. The alpha 1 receptor, these are postsynaptic sympathetic receptors. Alpha 2 receptors, these are the presynaptic sympathetic receptors. These are present in the heart. So this drug work on the heart as well as on the peripheral blood vessels. Okay, so therapeutic indication of this drug. Therapeutic indication are the pheochromocytoma, Raynaud's disease, and also it is used in case of paraplegia to prevent reflex tachycardia and to prevent further stroke. Paraplegia, okay, to prevent the reflex autonomic tachycardia, so that we can prevent the tachycardia, can prevent further stroke. Okay, to prevent further stroke. Okay, pheochromocytoma is a tumor of the adrenal medulla. This is the adrenal gland. This is the adrenal medulla. This is the tumor, pheochromocytoma, tumor of adrenal medulla. Raynaud's disease is a peripheral vascular disease. Okay, so these are the indications of the alpha adrenergic antagonist. Okay, so we got that. Now, what are the adverse effects of this drug? Adverse effect, again, adverse effect is postural hypotension, reflex tachycardia, nasal stuffiness, and sexual dysfunction. Okay, so why this happened? These are the adrenergic antagonists, so they will increase the how they work. They actually decrease the peripheral resistance. They also decrease the cardiac output. Okay, so they will decrease the blood vessel, the blood pressure. Okay. Okay, regarding cardiac output, in case of non-selective alpha-adrenergic antagonist, the alpha-2, even it may sometimes, on continued use, it may increase the cardiac output. So we may take out that part. Okay, so decrease peripheral resistance, decrease blood pressure. Okay, regarding cardiac output, initially it decreases cardiac output, but due to alpha-2 presynaptic receptor in the heart, okay, if that is blocked, we may have increase in cardiac output. So these are the adverse effects of this drug. These are the adverse effects. Adverse effects of the alpha-adrenergic antagonist, and this is the mode of action. Mode of action: decreasing peripheral resistance, decreasing blood pressure, and increasing reflex tachycardia by the baroreceptor mechanism. Tachycardia, reflex tachycardia. Okay, we got the mode of action of this drug and adverse effects. Any contraindication? Yes. Contraindication is decreased coronary perfusion. Decreased coronary perfusion. Okay, we got the contraindication, okay, of the alpha adrenergic antagonists. These are non-selective. Okay, they work on both alpha-1 and alpha-2. They block both alpha-1 and alpha-2. We got that. Now we'll go to the selective alpha adrenergic blockers. Okay, so we'll go to now the selective alpha, this is adrenergic, alpha-1 blockers. These are the drug. What are those drugs? These are the prazosin, doxazosin, and these are the terazosin, okay, josin, okay, and we have another drug that is called tamsulosin. They all are antihypertensive drug, all of them. This is especially these are useful in case of benign hyperplasia of prostate. Benign hyperplasia of prostate. So this is our urinary bladder. and this is the urethra, and this is the prostate in the male. Okay, so it decreases the smooth muscle tension in the internal urethral sphincter. This is bladder. Okay, bladder. What bladder? The urinary bladder. This is the prostate gland. There is a fibroglandular organ in male, a part of reproductive system. So this sphincter urethra, here is the sphincter urethra. That muscle is relaxed, so there will be no dribbling, no hesitancy, and there is no decrease in initiation of the urination because the sphincter muscle is relaxed. So what are the indication of this drug? Alpha-1 blocker. Number one, they are antihypertensive. Okay. Then they also decrease the benign hyperplasia of prostate. Okay. Size of the prostate is also decreased. Maturation is also good. They can easily urinate, and size little bit squeeze, and the sphincter is relaxed. So these are the indication for hypertension and benign hyperplasia of prostate. Hypertension by all the drug, but this is particularly useful in benign hyperplasia of the prostate. Okay, we got that. Now we have to know the adverse effect of this drug. Before going to the adverse effect, all of these drugs are metabolized by the liver and they are passed by the urine, except the doxorubicin. This passes in the feces and it has long duration of action. Passes in feces. Okay, and long duration of action. Okay, otherwise all are coming out through the urine, metabolized by the liver. Okay, all of them are antihypertensive except the tamsulosin, that is also very useful in the management of benign hyperplasia of prostate. Okay, for benign hyperplasia of prostate we have another drug that is called finasteride. That is a dihydroxytestosterone antagonist, but it is found that the alpha-1 blocker is a better drug for the benign hyperplasia of the prostate. Okay, adverse effect of this drug. Adverse effect. Again, adverse effect says postural hypotension. First dose effect. That is very important. Okay. Then tachycardia, reflex tachycardia. Okay. Sexual dysfunction like delayed ejaculation or disturbed ejaculation, and certainly vertigo. Okay, how to manage the first dose effect? First dose effect should be, patients should get the first dose around 1/3 to 1/4 of the usual dose, and patients should take this dose at bedtime so that there should not be any postural hypotension. Okay, this way we can manage the first dose effect. Okay, we got the adverse effect of the selective alpha-1 blockers. Now contraindication and drug interaction. Indication. Okay, before going to contraindication, in our adverse effect we may add congestive heart failure. Okay, congestive heart failure may develop eventually if it is the only one therapy. Okay, in monotherapy. Okay, that's why physician also add another antihypertensive drug maybe a diuretic. Okay, so we got that. Now we'll go to the contraindication. Contraindication. The person who take the alpha-1 blocker should not take the medication called PDE5 inhibitor that is used in case of erectile dysfunction like that of Viagra or Cialis. Okay, so the phosphodiesterase 5 inhibitor and the alpha-1 blocker should not go hand to hand. We may have, if the person take both the drug together, there may be excessive postural hypotension. So no prazosin and sildenafil or tadalafil or varanafil. No anti-erectile disease drug and the alpha-1 blocker should go together. It is contraindicated. Okay, drugs like that of the sildenafil. Okay, sildenafil. Okay, or tadalafil. Okay, like this drug. They should not go together. This is contraindicated. And that's all about the alpha blocker. If you like my video, please support my channel. Please subscribe me, share the information with your friends, and have a nice day. Bye now.